on pharmacy, the different areas of pharmacy that you can go into. We can talk about the business side if you wish. There's many different realms of practice. So when I get done or in between, if you have any questions, just raise your hand, because I do tend to kind of ramble on and sometimes talk too fast and give more information than what people really want to hear. So please, like I said, just let me know. But yeah, my name is Laura Wagner, and I have been a pharmacist now for 20 years. I am currently at Hubbard & Young Pharmacy, which is an independent retail. We're located right across from the Astro Theater, if anybody has seen our building. I graduated with a bachelor's in pharmacy, which is pretty much kind of an extinct degree now. That was a 5-year program, which was 1 year pharmacy, 1 year pre-pharmacy, 4 years pharmacy school. And now most schools now only have a 6-year PharmD degree. That has been the trend now for at least probably the last 10, 15 years. Back when I went to school, the only people who did a 6-year program were those who were really interested in the clinical side and were looking into more of like hospital area where they actually had clinical teams. You would have your standard pharmacist doing most of the daily duties, but then you would have clinical teams that would be comprised of PharmDs and doctors who would work on the kind of more at high risk or narrow therapeutic index drugs there in the hospital pharmacy. So I do just have a bachelor's, but like I said, most everybody now, it's 2 years of pre-pharmacy and 4 years of pharmacy school. Some schools, and I think even Clemson here, is now offering like a 3-year degree, and I know a lot of, as a pre-pharmacy, and I know a lot of other schools are going to that too, so that if you don't make it into pharmacy school, you at least have some type of a degree to be claimed when you finish. Pharmacy school has become extremely competitive. However, there have been more and more schools open up across the states over these past several years. I personally graduated from Purdue University in Lafayette, Indiana. It's one of the top 3 pharmacy schools in the nation. Very highly competitive. I think I read in the report last year that right now they're taking in yearly about 10,000 applications for pharmacy school, of which there's maybe 130, 140 spots. So that's just the one, one downside is that there's so many more applications than what the schools can house, and therefore I think you see a little bit more pharmacy schools popping up here and there to kind of to help accommodate that. There still is a shortage of pharmacists in a lot of areas. And those, like the new pharmacy school should kind of help accommodate that. Many different areas that you can go into. Of course, you have the retail pharmacy, and you have the chain, and the independent. Big difference here. I have actually had the opportunity to work both. My parents moved around a lot when I was in school, and so I did work both for Osco Drugs and then later for Kroger's. You're going to find different things in different areas, but as you know, in retail, you're dealing one-on-one with the customers. You're going to find in an independent that you're going to have a lot more personal relationships with the patients a lot of times than in the chain pharmacy. Sometimes in some chain pharmacies you're going to see a lot more interaction between the technician and the patient than the pharmacist and the patient, but that's not always true. When I worked for Kroger's, even though it was a chain, I certainly was able to make my pharmacy the way I wanted it to be, and so I made sure that I took the time to counsel and talk with the patients. And that is true at Hubbard & Young. We know everybody individually, we know their history, we talk to them, we counsel them, especially on any new medications. We try not to have so much of the technician patient interaction. We try to personally counsel as much as possible. We also do tend to fulfill some needs that the chain pharmacy normally, doesn't. We carry a lot of compression stockings. We carry some medical supplies that you don't find in a lot of chain stores. So there's some differences there, and we can talk some more about that later. There's also a compounding pharmacy. Some of these are independently owned and freestanding, and that's all they do. 24/7, they compound. Contained at Hubbard & Young, we also have a compounding pharmacy. We call it Clemson Pharmacist. And you're going to see a little bit more of a trend towards the compounding. Everybody gets some training in pharmacy school to compound. I mean, that's what pharmacists used to always do before all the industries took over and started making mass production of medications. And you will see a need, more often these days for what we call bioidentical hormones. That is a huge area. All these women going through menopause, they don't want to take pills. They want to use, hormone creams. So we make up a lot of those. We make up a lot of suspensions for children or for elderly. Medications that normally just come in a pill or capsule form. People can't swallow them, so we make suspensions. We do a lot of creams and ointments for dermatologists, and veterinary medicine. We make up a lot of different medications for cats and dogs. So you'll find liver and chicken flavor in our refrigerator there at the compounding pharmacy. So suppositories, we make up a lot of suppositories. So those are some things, and like I said, some pharmacies have just simply gone to just straight compounding, and that is their business, and it does fulfill a big need that has emerged. The other thing you can do is you can do nuclear pharmacy. The school that I went to, Purdue University, is really big in nuclear pharmacy. In fact, one of the graduates from Purdue, he operates all of he has probably about 4 or 5 satellites now in the Greenville, up into North Carolina, into Georgia, and they prepare a lot of the radioisotopes and things that you're going to need, to have diagnostic testing done. Nuclear pharmacy is really kind of a special area in itself. Pharmacists work very odd hours if you work at a nuclear pharmacy, because you are, mass producing these things, usually, 11 o'clock midnight through 4 o'clock in the morning, so that they can be shipped out to the hospitals and the diagnostic places, in time, because, they have a very short, a lot of them have a very short half-life, and they have to be prepared, at those times to get to the places. So that's a whole nother area. Of course, you have industry. A lot of people, some will go and be, pharmaceutical sales reps. Some, actually like to go into industry and do research. I talked about the old Bachelor of Science and now the PharmD degree, but just like with anything else, you can go and get a master's and a doctorate in specific areas of pharmacy, whether that be pharmacology, pharmacognosy, industrial. There's different areas, pharmacokinetics, all the different areas of pharmacy you can specialize in and do research. So that is another area. Those are kind of the main things. I said if you graduate with a PharmD, you are going to have more of a clinical basis. I know some people actually go and do a year's worth of residency once they finish pharmacy school. My sister did that. That usually do in a specific specified area, such as pediatric pharmacy, oncology, geriatric pharmacy. My sister, she has a really interesting job. She works for a VA hospital, but not in the hospital setting, but in the clinic setting. So she is on a team with I think, 3 other doctors. They have 2 teams. She is the pharmacist. There's 3 other doctors. And so they come in, and she just works clinic hours, Monday through Friday, no weekends. So she works with the doctors see the VA patients initially, and then any follow-ups, she's able to see them and adjust their cholesterol medication, adjust their blood pressure medication, refer them to a dietitian. She kind of serves as, patient management. Also serves, and as you'll see, also formularies are becoming more and more and more popular. Does everybody know what a formulary is? Okay. A formulary, let's say you have 7 different beta blockers to treat blood pressure and heart conditions. A pharmacy or a hospital, well, not a pharmacy, but a hospital or these big pharmacy benefit management systems for insurance companies, they will say, okay, you might have 7 drugs that are very similar. We're not going to pay for all 7 of those drugs. We're going to, maybe pay for 2 of them, and the rest of them are going to be non-preferred or non-covered items. Or they'll take non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, Aleve. Some of those you see over the counter, but there's probably about 20 more of them behind the counter. And they'll say, okay, we're going to select this medicine, A, B, and C, and the rest of them are going to be non-preferred. Don't get me going too much here, because this is all money-driven most of the time. Insurance companies getting kickbacks from the drug companies, it's really kind of crazy. Some of the times it really does make sense, but there's other times where it just, like I said, it's just so much money-driven. And so if you're in a setting where you have someone coming in from the outside with, certain medications, it's then my sister's job then to convert those non-formula medications over to formulary medications. So that's kind of a job that she has, and it's very, very nice. It was kind of a new position created probably 5 or 6 years ago, and you're going to find that more and more now, where pharmacists will be on teams with doctors, and they will work close together, which I think is absolutely wonderful. Basically, my responsibilities, pharmacists, basically, if you're in a retail pharmacy, if somebody brings you in a prescription, you are responsible ultimately for the safety of the patient. If the doctor makes an error, the pharmacist is responsible for catching it. There's a lot of responsibility there, and many, many, many lawsuits. Even though a nurse might make a mistake, a doctor might make a mistake, if it goes past the pharmacist is almost always held responsible, either in part or in full. We are like the last check system. So we have to, it's not so much just counting and filling prescriptions, but we have to do a lot of evaluating. Is this prescription, in the right dosage range? Is it right for the appropriate patient age? Is it right for the patient's condition? Drug interactions, that is such a huge, huge deal right now, and so we are responsible for catching drug interactions, and we see more and more of those all the time because people have access to specialists a lot more these days. You go to your family practitioner for something, they send you off to a specialist. So sometimes what we do is we have a specialist writing something, another specialist writing something, your family doctor writing something, and the patient does not always provide them with all the different medications that they're on. So we'll have somebody come in and, oh, I went to my one doctor and I've got this NSAID for arthritis, and then they'll go to a specialist, oh, maybe I've got tennis elbow or bursitis this time, and so they've got another one added on there. And so, thankfully, when we get to see that, we can say, hey, a person cannot be on 2 non-steroidal anti-inflammatory drugs at the same time.